Sleep problems are one of the most frightening and misunderstood changes after the age of 60. When deep sleep fades, the brain never fully recovers at night, leaving the nervous system under constant strain, even while the body appears to be resting. Now, hear me out. Large population studies cited by the American Heart Association show that seniors with poor sleep quality face up to a 50% higher risk of stroke even when they sleep the same number of hours because the brain never reaches its protective recovery state. But there is hope. In this episode, Japan's oldest doctor will show you a simple 20-second jaw trick you can do before bed to help the brain enter deeper, more restorative sleep during the most vulnerable hours of the night. You will learn 3 gentle techniques that calm the nervous system, improve breathing, and stabilize nighttime circulation, so the brain can finally shift into a state that protects blood flow and lowers stroke risk while you sleep. Welcome back to the Senior Health Podcast, where East meets West to help you stay steady, clear, and independent. Today we explore the link between poor sleep and nighttime stroke risk, how subtle tension the body holds can quietly disrupt both, and most importantly, the simple exercises that can help correct this. And to guide us through is Japan's oldest physician doctor. Please state the importance of this episode. Thank you, John. This is one of the most important episodes we have done. What happens during sleep can quietly determine whether the brain stays protected or becomes vulnerable. When sleep is shallow and the body remains tense, risk builds through the night. So everyone, please, I need you to stay with us, because what we share today addresses a danger that often appears only after it is too late. That's what I was thinking. So, what does this episode look like? In this episode, we will walk through a short bedtime sequence designed to release tension and protect the brain during the night. We will use the jaw gentle touch and breathing, and together, these signals work best to help the body settle into deeper, safer sleep. Talking about this topic, I always get reminded of a patient, a retired engineer in his 70s, who could not fall asleep and often woke up with his jaw clenched tight. Once today's sequence, his sleep not only improved within days, but also his nighttime blood pressure became more stable. So remarkable. When the body feels safe enough to let go, the brain can finally do its quiet work. And that's exactly where I want to go next before we demonstrate the first technique. Doctor, why does the jaw play such a powerful role in giving the body that sense of safety? And how does it influence sleep and nighttime stress? Well, the jaw is one of the body's oldest alarm systems, and it speaks directly to the brain. When it stays clenched, the brain reads that as danger, even if the room is quiet and the eyes are closed. After 60, this matters more because the nervous system already takes longer to settle at night. So, sleep becomes lighter. Not because the body is broken, but because it never receives the signal that it is safe. That really reframes sleep for me, because it sounds less like insomnia and more like the body staying on guard. Yes. And this is why so many seniors say they feel tired but wired at night. They believe stress or age is the cause. But often the deeper issue is unresolved tension held in the jaw and face. The brain cannot drop into deep sleep while those muscles are quietly bracing. I hear that a lot in patients who tell me they feel exhausted but restless the moment their head hits the pillow. It is surprising how rarely we talk about the jaw when we talk about sleep. That is true. And the night itself adds another layer of vulnerability. Blood pressure, breathing patterns, and circulation naturally change after midnight. If the jaw remains tight, breathing becomes shallow, and pressure does not settle the way it should. Right. That's so interesting, John. This is also when the risk of stroke quietly rises because the brain is under strain while the body is least protected. Large-scale Japanese cohort studies, including data from the Hayama study, have shown that older adults with disrupted sleep patterns and poor nighttime autonomic regulation have up to a 50% higher risk of stroke, with the highest incidence occurring during the night and early morning hours. That makes the nighttime window feel much more serious than most people realize. It is serious, but it is also hopeful. The body listens closely to physical signals, especially simple ones. The jaw, the area behind the ears, and the breath all act like switches that tell the brain whether it can stand down or stay alert. So these signals are not just about comfort. They are actually communicating safety. That changes how I think about small movements before bed. Indeed. And this is where small actions matter more than force or effort. You do not need to stretch or push the body at night. You need to show it gently and clearly that the threat has passed. When that happens, breathing deepens, pressure stabilizes, and the brain begins to protect itself. This is why I always start with the jaw. It feels like you are describing a doorway into sleep rather than a technique. Yes, and that doorway can open very quickly when approached the right way. There's a simple release that tells the brain it no longer needs to hold on. Once you feel it, the shift is unmistakable. I am really curious about that because seniors often assume release takes time or effort. Can you show us what that jaw release looks like and why it works so fast? Of course. Let's dive into the first part of the sequence step by step and take it slowly. We start by warming your hands for a few seconds. Then place them gently on the sides of your head just above the ears. Now, over at least 10 seconds, slowly slide your hands down along the sides of your face toward the jaw. As your hands move downward, allow the jaw to fall open naturally, as if you are softly saying, "Ah." That pace feels almost meditative, not like an exercise at all. Yes, and that slowness is essential. The jaw should never be pulled or guided. It simply drops as the hands move. Once your hands reach the jaw, let the mouth stay open and relaxed for another 10 seconds. I notice the teeth are completely apart and nothing feels strained. It looks like the face is just letting go. Exactly. And this leads us forward. During those 10 seconds, keep the tongue loose and breathe normally. You do not need to control the breath or make it deeper. The airway opens on its own. When the jaw releases this way, it really does feel passive, like the body knows what to do. Yes, and that is the intention at night. After those 10 seconds, allow the mouth to close gently without clenching. Then rest for a few seconds. Then repeat the entire movement one more time. So the whole sequence still stays very short and manageable. The key here is repetition without effort. You slide the hands down slowly for 10 seconds, hold the jaw open for 10 seconds, and repeat once more. One rep only takes about 20 seconds. When doing this multiple times, the total time just under a minute. That's so easy to adopt in your bedtime routine. Exactly. And for many seniors, breathing softens and facial tension releases almost immediately. Studies from Japan and Europe have shown that gentle jaw and facial relaxation can reduce nighttime sympathetic nervous system activity by more than 20% within minutes, leading to measurable drops in heart rate and blood pressure. This matters because sustained nighttime nervous system activation and elevated blood pressure are strongly linked to higher stroke risk during sleep. This is how small releases begin to quiet the stress signals that silently strain the brain overnight. It's so remarkable how scientifically grounded the responses from this exercise in such a short window. But there is more, right? Yes, this is just an amazing foundation because there is a simple way to deepen this effect even further. It involves a gentle point of contact just behind the ear. When added next, I'm curious about that because it sounds just as precise and gentle. Where exactly does that next step come in and how should it be done safely? Of course. Let me explain the next step of the sequence carefully, because this step works through touch, not effort. Once the jaw has softened, you bring one thumb to the mastoid area, the bony spot just behind the ear where the head meets the neck. The pressure should be very light, more like resting the thumb than pressing into it. This area responds quickly because it is closely connected to how the brain senses safety. Yes, sir. And that reminds me how instinctive this can be. Many seniors touch this area when they are tired or overwhelmed. We are simply using that instinct in a calm, intentional way. That feels surprisingly gentle, almost like something people might already do without realizing it. Exactly. So, let's look at what to do here step by step. With the thumb resting on that mastoid area behind the ear, you begin making very small circular movements. The circles should be gentle, almost subtle, And you continue for about 100 slow circles, taking your time and letting the motion stay relaxed. You focus on one ear at a time, without rushing to the other side. There is no need to press harder or move faster. The goal is not stimulation through force, but through consistency, allowing the nervous system to recognize the repeated steady signal. It feels less like a technique and more like a soothing rhythm. Yes, and that rhythm matters at night. These small circles help activate the parasympathetic nervous system, the part of the body responsible for calm, digestion, and recovery. As that system comes online, the signals that keep the body alert begin to quiet, reinforcing the message that nothing needs to be guarded. That explains why seniors often feel calmer without consciously trying to relax. The key here is simplicity and patience. One thumb, small circles, one ear at a time. Clinical studies from Japan examining gentle or auricular and mastoid stimulation have shown measurable increases in parasympathetic activity and reductions in nighttime heart rate and blood pressure within minutes, changes that are associated with a lower risk of nocturnal stroke. As the nervous system settles, breathing often softens on its own, and circulation becomes steadier, which is one of the ways nighttime stability begins to return again. It is amazing how such a small touch can shift so much internally. But I bet there is more, right? There is one part of the sequence left. You are always correct, John. There is one final step that brings everything together. It requires no hands at all, only attention to the breath. When done after these two steps, it completes the signal of safety. I'm curious about that, because breathing often feels harder to change than touch. How do seniors approach that final step without overthinking it? Of course, let me explain it in a way that feels natural, not technical. Breathing becomes difficult to change only when we try to control it. So the goal here is to let the breath follow the calm you have already created. That makes sense because seniors often tell me they tense up the moment breathing is mentioned. It feels like something they might do wrong if they think too hard about it. Yes, and that reminds me why this step must stay simple. You begin by breathing in quietly through the nose, without trying to make it deep. Then you allow the breath to leave a little more slowly than it came in. That feels much more approachable. Exactly. The key here is that the exhale is slightly longer, not forced. This tells the body that the danger has passed and the night is safe. It sounds like you are letting the breath settle rather than directing it. Yes. Now let's continue. As the exhale lengthens, oxygen levels stabilize and circulation becomes steadier. Over a few breaths, the brain shifts into a protective nighttime rhythm. That helps explain why seniors often feel sleepy without trying to sleep. And here is what I want listeners to remember as they do this. If the breath feels gentle, you are doing it correctly. If it feels effortful, you are trying too hard. That reassurance alone probably helps seniors let go. Indeed, this final step works because it completes the message of safety. Jaw release, gentle touch, and slow breathing all speak the same language to the brain. When they come together, the body knows it is time to rest. That really brings the whole sequence together in a way that feels calm and doable. So, before we close, please everyone stay with me for a few more seconds. Is it fair to say that once this rhythm is felt, sleep often follows on its own? Yes, that is often exactly what happens when the body receives the same calm message through the jaw, gentle touch, and breath. Sleep no longer needs to be chased, and we don't have to worry about strokes during sleep. That's a perfect message to end on. Doctor, to everyone listening, please practice carefully. Watch this video multiple times and give it a thumbs up. Oh, and watch this next video right now. Yes, music please. We've picked this one especially for you.